And welcome back to another edition of the Association Spotlight Series. We have a new guest with us here today. And tell us a little bit about yourself, who you are, and who you work for.
My name is Felicia Roark. I am a social worker, therapist too for Thomas Health Systems. I also like to say miracle worker. I have been with Thomas Health for, it'll be 8 years actually in May. And I've held various positions. When I graduated high school, my intentions were to write books to help others. And then a friend of mine was like, hey, you can actually directly work with people and help people. And I was like, oh, okay. So I ended up getting an associate of science in community behavioral health. And then I went on to get a bachelor's in behavioral science and health science. And then I went on to get my master's degree in social work. And I've been very fortunate that I was able to do a lot of this while I was at Thomas. When I started there, I had my bachelor's degree, and they were able to work with me with my graduate degree. And I did various roles while I've been there. I actually started out as a CNA.
Okay.
And then I moved up to a case manager on our geriatric psych floor. So a lot of my population was Alzheimer's dementia patients.
Okay.
And then I actually moved to Connections, which is our intake assessment department. So I was seeing people in the ER and the medical floor that were in crisis situation and determining the appropriate level of care for them.
Right.
And then I actually ended up switching to medical social work for a little bit. And then I came back, and now I work at the Addiction Healing Center. And I love my job, and I get to work with people who are affected by substance use and mental health issues.
Right, which is such a big thing right now, obviously, not just in West Virginia, but in our country as a whole. So it's great. And I guess that would lead to the next question of, telling these people these positions they're tough, they're strenuous, and there are super fulfilling parts about them. Where does that weigh with you in terms of, maybe not every day is that easy, but I mean, what do you gain from it? It's just showing up every day and helping these people.
It is definitely challenging. There are unfortunately barriers, whether it's from continued care after treatment, whether it's maintaining a patient in treatment due to health insurance. And so, it definitely can be frustrating, but honestly, I think the best way I describe it, and I even tell my patients, and they probably think I'm a little odd, but when they come in, it's like they're in a cocoon.
Okay.
And as they stay with us, I watch them blossom into a butterfly. And just watching that change from A to B it's beautiful, because right. They're so hopeless. They're helpless. They have no self-esteem. It's hard for them to even realize their own potential. And by the time they leave, they have so much more confidence. They're happy. They're so much more serious about their recovery and realizing what they've done and how they want to move forward. And for me, that is worth anything, any hard days. It's worth everything. And it definitely is very humbling.
Gotcha. That's great. What would you say that you love most about your job? I know you touched on that a little bit. But is it just really seeing that progression and seeing it, folks from the darkest of days and then getting them out and they're just a new person entirely, right?
It is. And especially when you get those follow-up calls, because occasionally I do have patients that'll call and touch base. I actually have about 5 patients that I've been able to kind of track what they're doing, and they have over a year sobriety. Some are coming up on 2 years.
Wow.
And for me, that tells me that what we're doing is working.
Yeah.
And that is all the motivation that I need. And I couldn't imagine myself in a different position.
Right. What first got you interested in behavioral health? I know that we talked a little bit before, what path and maybe what major you would have in school, but what was your first kind of interest that got you here?
Well, I spent a summer working with children with IDD.
Okay.
And just watching them live life despite having setbacks, it was beautiful. And so that really motivated me. And then I ended up working for Prestera for 2 years in substance abuse, and that just kind of furthered. But also, I have personal experience. My dad was actually an alcoholic, and I unfortunately lost him to cirrhosis. And so a lot of this and my passion is from being in the madness with him. And, I watched him succumb to his addiction. And so for me, if I can touch one life, I'm doing my job, and I'm fulfilling a legacy for my dad, of trying to reach out to others.
Right. Absolutely. Yeah, that's great. It's very important. It sounds very close to home, and you've had a myriad of jobs. It seems you've seen almost the full spectrum really, of the behavioral healthcare world. So yeah, that's great. What advice would you give to someone interested in the behavioral healthcare field, and how they can work their way up, kind of not just to have a job, but really have a nice sustainable career and kind of come up through the ranks?
Definitely education's so important. I don't think I could preach that enough. And not just degrees. I think it's also super important to attend conferences to continue that education, because in the field of behavioral health, everything is always changing. There's new evidence-based practices. But for those who are wanting to do it, keep with it. Days are going to be hard, and I can attest to that. Burnout is real, but you have so much flexibility in our field that you can move around. And for that, you can change up the pace. You can do different things. So if you find that this isn't your thing, try something else. And eventually you'll find your niche, and you'll be able to move up, and your job won't feel like your job. Right.
Absolutely. And I'm sure you've seen such an uptick with pandemic-related mental health issues and substance use issues. Mm-hmm. What do you think? What do you think we are doing here in the behavioral health care field? That is, how can we fight this? I know it's very tough, and it takes everyone. How are you all progressing through that, and maybe changing up your all's methods a little bit in terms of mental health and substance regarding around the pandemic?
With the pandemic, we saw a lot of overdosing. We saw a lot of patients isolated. One of the things that we've been very fortunate, we have recovery coaches who follow up with people. Okay. And so, it was reaching out, letting them know, like, hey, how are you doing? Just kind of checking in. When meetings shut down, that was a huge thing, because as we know, social support's very significant in our field. Yep. And so I think now, with things opening up a little bit more, we make sure to get them connected with meetings. We actually hold outside meetings on the unit, as far as through via Zoom, but at least making those connections so they have familiar faces. For us, our unit, we actually had to step back from beds and move. So now we're back into our bigger unit, so we have more capacity. And I think with the mental health problems as well, just like I said, with that isolation and stuff, we've been trying to connect people to more services. Our outpatient services at Thomas, we did Zoom for a little bit, but we tried to keep them in person as much as we possibly could, because we knew that was detrimental for them.